You've definitely seen it. It's on Olympic athletes, maybe even your friend at the gym, that super colorful patterned tape. But what's it actually doing? Well, today we're going to pull back the curtain and break down the science behind kinesiotaping. Here's how we're going to tackle this. First, we'll get into what this tape is and how it's totally different from that old school white athletic tape. Then, we'll dive right into the science of how it works, see how the pros use it, and wrap it all up with a clear verdict on whether it's legit or just hype. All right, so let's start with the absolute basics. What in the world is this stuff that we're seeing everywhere? I mean, you can't miss it, right? You see this vibrant web of tape on a volleyball player's shoulder or maybe a runner's knee, and you have to wonder, is that just for decoration or is there some real science going on there? Okay, so at its very core, kinesiotaping is the complete opposite of that stiff, white tape you might be thinking of. It's specifically designed to give your body support without stopping you from moving naturally. And that right there, that's the whole point. Support without restriction. And it might seem like some brand new trend, but get this. It was actually developed way back in the 1970s by Dr. Kenzo Kase. It kind of flew under the radar for a while until, boom, the Olympics put it on the world stage. Now it's pretty much a standard tool in clinics everywhere. That whole idea of moving freely while getting support, that's what really makes kinesiotape a game changer. So let's break down exactly what sets it apart. So think of traditional tape like a mini cast, right? Its only job is to lock a joint down and stop it from moving. Kinesiotape is the exact opposite. It's super elastic, it lets you move completely, and you can even wear it for days at a time. The goal isn't immobilization, it's rehabilitation while you move. And the secret sauce to all this freedom? It's the elasticity. This tape can stretch 30 to 40% of its original length, which, and this is the cool part, is designed to perfectly mimic the stretchiness of our own skin. It literally moves with you, which of course brings us to the big question, how on earth can a piece of tape actually do all of this? This is the aha moment. This is where we get into the really fascinating science behind it all. The entire method, the whole thing, is built on one simple but powerful idea. Your skin is like a gateway to everything underneath it. So by interacting with the skin, the tape can actually influence your muscles, your fascia, that's your body's connective tissue, and even your lymphatic system, which is what helps control swelling. So the first thing it does is gently lift the skin. It's microscopic, but imagine just pulling your t-shirt a tiny bit away from your arm. That little bit of space the tape creates is just enough to take pressure off your pain receptors and, at the same time, improve the flow of blood and fluid right under the skin. Second, and this is so cool, it essentially runs interference for your nervous system. Picture your brain's attention span as a busy highway. The gentle, constant feeling from the tape creates a ton of traffic, kind of clogging up the lanes. This means the smaller, slower cars, which are the pain signals from your injury, they just can't get through. That's the famous gate control theory in action. The tape sensation closes the gate on pain. And finally, the tape acts like a gentle, constant reminder for your body. It gives you sensory feedback that helps your brain get a better sense of where your body is in space. We call that proprioception, and it's absolutely crucial for helping you move with better control and hopefully not get hurt again. Okay, so we've got the theory down, but how does a therapist in the real world use this one tool to get totally different, sometimes even opposite results? This is where the technique gets really, really clever. Just changing the direction you apply the tape completely flips its effect. So to help a weak muscle fire up, a therapist will tape from where the muscle starts, its origin, to where it ends. But what if you want to calm down a tight, overactive muscle? You do the exact opposite. It's an incredibly precise skill. And it's not just about direction. The actual shape of the tape is a whole other part of the toolbox. A simple I strip can target pain. A Y strip is perfect for wrapping around a muscle to support it. An X cut gives you stability from all different angles. And a fan cut, that's specifically for helping drain away swelling. So who is this for exactly? Honestly, the applications are just incredibly broad. It covers everything from peak performance to everyday recovery. You see it in sports for things like strains and sprains, sure, but also for managing chronic stuff like back and neck pain. It even shows up in post-surgical rehab to help with swelling or for patients recovering from a stroke. Okay, so after all of that, what's the bottom line? Let's get to the final verdict. Because it's really important to see this technique for what it is, a really helpful tool, but it is definitely not a magic bullet. And this part is crucial. You can't just slap this tape on anywhere and expect a miracle. Its effectiveness is 100% dependent on a professional's assessment and, of course, their application technique. And, maybe most importantly, it is never, ever a substitute for the real work of exercise and rehab. Really, the best way to think about it is as an adjunct therapy. That's just a fancy way of saying it's a helper. It's designed to work with a complete treatment plan, alongside your exercises, any hands-on therapy, and posture work. It enhances the recovery, it doesn't create it all by itself. So there you have it. Kinesiotape isn't some kind of magic, but it is a tool grounded in science that can help reduce pain and support the healing process when it's used the right way by someone who knows what they're doing. It's a really valuable piece of a much bigger recovery puzzle. And I guess the final question is, could it have a place in yours?